And welcome to another edition of Battleground Florida. I am Christopher Heath, coming to you from the Parish Healthcare Podcast Studio here at WFTV. And we're talking about coronavirus. I got two great guests lined up for today. You'll hear from Peter Schorsch of Florida Politics coming up a little bit later. His outlet, his news outlet, broke the story of there being two confirmed cases. They did that Sunday night. I talked to him a little bit about that reporting, as well as the response we've seen from the Florida Department of Health, which hasn't been so great, to the response we've seen from the governor and other elected officials, including Stephanie Murphy, Congresswoman Stephanie Murphy, who had a roundtable on coronavirus 2 weeks ago. So we've seen some of these conflicting methods of approaching this. But I also want to bring in WFTV reporter Lauren Seabrook, who went out to Tampa today to go cover the press conference. And when I say today, it's Monday. This may be in your feed on Tuesday. But you were there. The governor's there. We have the top leaders from the Florida Department of Health. And they're trying to get out in front of this. And part of the reason is we have two cases now.
Right. And I think, they did get... They did hear from a lot of people that there was a lack of transparency last week, and I think they tried to address that a little bit more and get out in front of it and get a lot more information out today. Some of the reporting we did last week was about how they refused to give us the numbers of how many people had been tested, how many people were in isolation. Today, they loaded us with numbers. I mean, we know 184 people are currently in isolation, which seems like a lot compared to the fact that we have two cases confirmed, and then I think we have 8 cases that they are still waiting on the results to, it takes about 24 to 48 hours to get the results of the test, and then another 5 days for the CDC to confirm it. So, it can take some time for us to find out these things, but one of the things they got a little hammered on today at the press conference was the fact that they confirmed these cases on Saturday night, but did not tell the public about them until Sunday night, so a full 24 hours. And the Surgeon General said basically the reason for that was that he wanted to wait for the CDC to confirm it, and then kind of decided, well, actually, maybe we should go ahead and let the public know.
See, that boggles my mind. Maybe 20 years ago, 30 years ago, you could get away with that kind of a delay. Better safe than sorry. Let's get all of our ducks in a row. Yeah. But when you have a pretty good inclination that that's what this is, you get it out there. And
Absolutely.
You say, hey, listen, we're sending these to the CDC. It could always come back as it's not, but I just want to let you know where things are at, because in this era that we're in, vacuums get filled. Mm-hmm. If the Florida Department of Health, which has been very cagey about saying anything, won't say anything. I went to Stephanie Murphy's roundtable on the coronavirus, and she invited the Florida Department of Health. They declined to show up. When there's a hole there, it gets filled, and it usually gets filled with garbage.
Yep. And especially when you're talking about someone who, one of these cases, it's a 20-year-old woman who traveled to Italy, but the other case, 60-year-old man who they don't know how he got it. So it's important, every minute counts when you're dealing with someone who does have a confirmed case of it. You don't know how he got it. You don't know who he's been exposed to. And you do need to be contacting those people, and you need to let the public know just in case maybe they've been in contact with somebody in that area.
And the thing is, in the United States and in Florida, we have fantastic health care. Now, I talked to Peter later on the podcast. We'll get into some of the more political questions about the fact that a lot of working poor in the state can't afford health care, don't have access to it, those kind of things. But we do have much better medicine here than the Wuhan province of China.
Right.
That's just a fact.
Yeah.
So if you go to the hospital and you are confirmed with the coronavirus, your chances of survival are much, much greater. Yeah. But people still want to know what's going on. Even if you can say at the end of the day, this is going to be no worse than the flu, which we deal with every year. That's fine.
Right.
But level with me.
Well, and I think people feel somewhat safe to the flu because maybe they got their flu shot. I think it worries people that there is no vaccine for this, and it's something that they could get. And there's a lot of unknowns. It's so new. I mean, you have these top state health officials standing up there saying, this is so new. We're learning about it as we go. And even though, they are saying most people who die are over the age of 55, have underlying health issues, there's still some uncertainty because it is so new.
And when you say, oh, well, it's only people over 55, people with depleted immune systems and the elderly who are affected. Well, if you're somebody that's in the working poor, which we have a lot of in Florida, right, you may not have gotten the best health care during your life. You may not have a great immune system. We also have a lot of retirees. My parents are both in their 70s and live here.
Yep.
And I think about them. I'm like, okay, the coronavirus maybe is not a threat to me at 41. To them, it is.
Right. And a lot of times you hear, in the elderly patients, and when I think of elderly, I think of like 80 plus. I don't think 55 plus. That we're not talking about, people who are on their final stages of their life. I mean, this is our parents' age, and younger. So I think when you hear 55 and up, like that's not very old.
So tell me about being at the press conference, because I saw the way that DeSantis was handling it versus the way that some of the medical professionals and members of the Florida Department of Health were approaching it. And it definitely felt like he does not want, this may be more of a political question, but he does not want a Bush-Katrina moment. Right. Brownie, you're doing a heck of a job. He wanted to feel like, or at least put out that he's in charge of this. He's getting out in front of it. But at the same time, there were questions even he was not interested in talking about.
Yeah, absolutely. I mean, I think one thing you have to give him is that he's much more comfortable and used to speaking in front of the media, taking hard questions from the media than people in, healthcare. But there were some questions he didn't take from us. I think there was some frustration on his end and with the other people who spoke because they were taking on some hard questions that they just decided we're not going to take questions anymore. And so we had some questions about our local economy, how this could impact the parks and how this could impact tourism across the state. He wouldn't even answer that question as he walked literally inches in front of me. And I said, what about tourism? Are you talking to the parks? Are you talking to Visit Florida? And silence.
And that's our bread butter here. That is it. Because it's only going to take a couple of cases and you will start to see people canceling vacations.
Yeah. And I mean, we've already reported on 6 Disney employees who are in isolation because they recently came back from Italy. And the one confirmed case out in the Tampa area, a girl is from Italy. So, those people are still in isolation. We don't know what their status is. We don't know if they've been tested or whatnot. But I think that that's already concerned some people. Now we have 2 cases in Florida. It's not going to be long before people say we're not going to Florida this year.
Well, and again, I mean, you and I talked about this already. Not to make a mountain out of a molehill. This is a virus. It is a potentially deadly virus. It is extraordinarily contagious, but it's also something that we are capable of handling.
Right.
The question becomes, how are we prepared for this? Because whether or not we have the coronavirus fades or another virus a year from now or 2 years from now, there will be another pandemic. There will be another outbreak of something. And we need to know that the people that we trust to do their jobs, do their jobs.
Right. And are transparent about it and are letting us know immediately what the numbers look like, how serious it is, and not just trying to say, we don't want to scare anybody, so we're not going to give out any information. I think that sort of becomes shady to people, and it scares them even more, I think, in some ways.
So at the press conference, they're trying to get the message to the public and through us, the media. I mean, that's part of our job, is to be the proxy for the public. What did you take away from that?
I think, compared to the press conferences that we saw last week, I think that we were definitely getting a lot more information. I think that it became very clear to them that we were going to hammer them until they gave us the information that we feel like the public deserves to know. On the reverse side of that, I was tweeting some of the information from the press conference, and people were kind of firing back saying, stop scaring us. This isn't as big of a deal as you're making it out to be. And I really don't think that anyone was making it out to be a scary thing. I think he repeatedly said our risk is still very low in the state of Florida. We only have 2 cases compared to, places across the world that are seeing more of a widespread, what's the word I'm looking for?
Yeah,
outbreak, I guess. People get nervous when you say the word outbreak, but I think overall, it's been calm. I don't think that people are panicking or freaking out over this. I think it's just something we're not quite used to.
I was out at Universal on Friday with my son, and I saw maybe a half dozen people with masks on, and setting aside the CDC recommendations for masks. They're mainly for people that have the virus, not for people that are afraid of contracting it. But leaving that aside, you do hear that. And we get that from people pushing back at us and saying, all you're doing is fear-mongering. I can't speak for every single media outlet out there.
Yeah.
We're not monolithic. We don't all get up in the morning and have a giant media meeting.
Yeah.
But I feel like at least here at Channel 9, and I'll even extend it out to what I've seen on the Orlando Sentinel and some of the other local outlets here, it's been very much, here's what's going on. Here are the numbers. Here's what the CDC says.
Right.
Here's what they're recommending you should do. Take that information and do with it what you will.
Right.
Nobody's saying lock your doors, pull your kids out of school, don't ever go to another theme park.
Yeah.
If somebody sneezes near you, just spray them with Purell. Nobody's saying that. It's the information getting presented to you, and you do with it what you want. I don't like the idea that it's like, don't tell us this because it's too scary.
Right.
You need to know what's going on.
Yeah, and I think, yes, we are talking about it a lot more than maybe we're talking about some other things right now, but part of that is because we know there are people that are very worried about it. I put out a question on social media last week. How worried are you? Scale of 1 to 10. I was shocked by how many people wrote 10. They really are that concerned about it. So we're putting a lot of information out to put the public at ease. And I think also, even for most of us, a bigger concern than even getting sick is what it could do to our local economy. And so that's an important part of the story too.
Yeah, and it doesn't take much. You saw last week, we saw the Dow take a couple days of plunges, and that's just the companies that rely on international trade, specifically through China, looking at their first quarter numbers and saying, we're not going to hit our mark. And they're starting to send some warning flags out there. And again, our economy here is very dependent on tourism. Yep. And and you don't want to say, well, you can't put a price on a human life, of course, but we're also a part of the state that if all of a sudden we see a 10% reduction in tourism, that is a big, big deal.
Absolutely. And we're also dealing with it not just in the parks, but also with the cruise ships. I'm actually going on a cruise in July, and I've started to think, should I be concerned about canceling? And not because I'm really worried about getting sick. I'm just worried that it's going to screw with my plans. You know what I mean? Especially now when they're saying some people coming back from Italy are going to have to self-isolate for 14 days. If you're not even sick, you don't want to use that time off work, the 14 days of just sitting at home doing nothing when you could go on vacation, I talked
to Peter about this very point later on in the podcast, but we talk about the fact that a lot of people don't have paid sick time.
Right.
Those 14 days, you're just not going to make any money, and you might be able to afford it.
Yeah.
You mentioned the scale of 1 to 10 being scared. I was on a podcast with our radio partners last week, and we talked about coronavirus. Obviously, this is before we started to see the cases here in Florida and in other parts of the country. And the same kind of question got asked on a scale of 1 to 10. Everyone there gave it like a 1 or a 2. I gave it a 7. And my reasoning was this. So much of the information we have about this has been coming out of China. And I do not trust information coming out of China, be it medical information or their economic data that they put out. It is all scrubbed. It's all pre-approved. You don't know what you're getting. And that's what my concern was. And it still is. Now, as we see the virus go into places like the United States, like Italy, places that are a little bit more open, that have a lot better medical care, we get a better feel for what we're dealing with. Yeah. But when all the information we're getting was coming out of China, I'm sitting there saying, if they say 3,000 are infected, that could be 30,000, and we'd never know.
Don't know if we can trust it. Yeah, it's the fear of the unknown, really. And I think we're starting to see a lot more good data, I guess, coming out of the U.S. now that more people are getting it here. I know one of the things they talked about today was they are actually recommending that nursing homes and assisted living centers limit their visitations and maybe even cut visitation completely right now. And that's because we've seen some patients and some smaller outbreaks, I guess you could maybe call it, at nursing homes in Washington. And so I think that's the information we got to pay attention to, because that's what we can relate to. And immediately our state officials are on it, and they're making changes to make sure that we don't have something similar happen here.
All right, Lauren, great reporting on this. And I know you're going to stay on top of it and keep covering it. And so we really appreciate that. And hopefully this runs whatever course it's going to run. The effects are minimal or even less. That'd be fantastic. But we'll keep an eye on it. And I do appreciate you coming in. And we will have Peter Schorsch coming up next. Hey, I was on Twitter Sunday night and putting the boys to bed, getting ready for the week ahead. And I see you started tweeting out that there was some movement as far as Florida finally starting to confirm not just the testing of people for coronavirus, but also the possibility of there being not 1 but 2 confirmed cases, and of course within a very short period of time, you guys over there at Florida Politics not only confirmed that, but then also set the stage for what we saw on Monday, which was the governor and the leading health experts from the state holding not one but two press conferences, one over in the Tampa area and another down in Miami, discussing this. This escalated fairly rapidly.
It did. As a lot of people have talked about, there was a letter from Doctors Hospital of Sarasota floating around on Facebook and social media. I was forwarded it maybe a dozen times from, people in Tallahassee, but also people in Sarasota, friends, etc. And I kept digging on it, and I called the public information people at that hospital, and they wanted nothing to do with it. And I just got this feeling that something had gone wrong on the communication process. And so, I started working it through my sources in the governor's office and my sources at the Department of Health and said, hey, listen, whether or not you want to talk to me, this is out here and this is scaring the crap out of a lot of people. So number one, you all need to get your stuff together. And number two, let's talk about this so that we can responsibly write the story. We had the details on the story for a couple of hours, and it would be interesting reading on for someone to see our Slack channel with all the reporters, because the reporters, they thought they had it, locked down, their sources, etc. And I just kept telling them, I'm like, listen, we're not going to put out there that there are 2 cases of coronavirus unless we have got this solid. I was not going to start a panic in the Sunshine State. No matter, we had a state senator who was telling us that it was for real. We had a county commissioner in Sarasota telling us that they had been contacted, but I wanted to hear from someone at the state level. And so, you know it better than I do. It's exciting when you're chasing one of those stories. I didn't think that there were a lot of other people that were chasing it at the state level, but I knew that everybody had seen that letter from the hospital, so I knew that we were kind of under the gun there. So it was exciting. It was exciting for our little digital only website to get that kind of scoop.
And then we've seen the response coming out of the governor. And I would say Governor DeSantis' office has tried to get out in front of this, has tried to put a very public-facing face out there and show people what they're doing. Meanwhile, those of us who have been covering it, Florida Department of Health has not been particularly helpful. We had a roundtable about 2 weeks ago with Congresswoman Stephanie Murphy. She had health experts there, and She invited the Florida Department of Health to attend. They just flat out declined. That's when we got confirmation here in Orange County that they actually tested 2 people who came back negative for coronavirus. But, the Department of Health's not telling this information. So the 2 contrasts there are the governor's office trying to get out ahead of this because obviously he realizes this is a political football, and the Department of Health just radio silence.
Well, I think let's take a step back and, I'm sure you've heard this 1,000 times. This is not as bad as the flu, or people have tried to compare it to the previous SARS incident, to swine flu, to N1H1, etc. And I want to tell everybody, all of those pandemics took place in a different social media environment. Even though they were only a few years ago and we can still remember them, it is completely different now. We have a president whose first inclination is to shoot on Twitter first and ask questions later. I'm not even criticizing him for that. But that has also trickled down to other people. So instead of being scared and waiting for information from authorities, people are posting letters from hospitals and asking, hey, what is this? And so I don't know that necessarily the state government has adapted to that and has, realized that, the news cycle is moving every couple of hours here, and you have got people that are spreading information. You may have saw the survey that talked about how that there were more than 2 million basically hoax tweets outside of the United States about coronavirus. And I'm not saying that that's what happened inside the United States or what happened last night, but this is a different media environment for this information. The information about the disease is spreading quicker than the viral disease itself. And so Scott Rivkees, Ron DeSantis, Jeanette Nunez, they have to be prepared for that. There was a moment today, if you were watching the press conference, Dr. Scott Rivkees, the Surgeon General, was giving kind of antiseptic doctoral answers to some of the questions. And you saw Ron DeSantis kind of jump in because he's a politician. We need more definitive answers for things. And so I think you're going to see, will Ron DeSantis's instincts for smart communications prevail over, kind of the hold information back. I think that the Department of Health is going to have a lot of questions to answer about why they took so long, at least 24 hours, to inform the public that there had been 2 people who tested presumptively positive for coronavirus.
And one of the things you see people saying is they're like, listen, don't listen to your friends and family on social media or the anonymous Twitter accounts. They may be well-intentioned, but go to the CDC for information, go to the State Department of Health for information. And you almost wonder, is their credibility in those agencies diminished because they're not responsive as quickly as they should be? Not so much the CDC, but more of the Department of Health, because if we know that they held this for a full 24 hours before informing the public, I'm sorry, if I'm an average citizen hearing that, I'm saying, okay, if they didn't think it was important enough to tell me for 24 hours, I'm not coming to them for, well, what can I do to prevent this, or what can I do to protect my family?
I think you're onto something there. I think number one, there's a lack of trust in institutions themselves. Again, you have a president who has told us not to trust the CIA, to not trust the FBI, to not trust NOAA during hurricanes, and so you definitely have a segment of the public that has been, taught and believes not to inherently trust these institutions. But then also, I think wash your hands is not enough for people. If that's the only advice you can give to people right now, wash your hands, don't touch things, stay home. It's almost too simple of a message in this complicated world. And I know that it is the best message. But I think that people who can, we live in a world where you can, everybody is a Google doctor. And so I think people, they kind of want a little bit more information than that. And so, again, I think you're going to have to see, we still have people that we don't understand how this has come from China. We don't understand. I literally was speaking with a top public affairs pro just a couple minutes ago she is scared to death about what is going on. And she was asking me, she's like, have we even, confirmed how this came to be? Did this really come because people were eating exotic animals in a Chinese market over in Wuhan? And, so we've never had that. We've, and I blame the president, who during he had the opportunity. We need a lot more education. It would have been nice if President Trump had stopped and educated the people about what this thing is, rather than just jumping in to a political rally and saying, not that it was a hoax, but that you shouldn't even use the word hoax right now. It should just be stricken from everyone's vernacular right now, and including the President of the United States.
Well, and listen, it should be axiomatic that when you take a Sharpie to a National Weather Service map, that is not inconsequential when it comes time 3 months later to have to go before the nation and explain to them, listen, there's a virus out there. Yes, it's very contagious. No, we do not have a vaccine, which is something else where the president went way far afield. And that, listen, it's going to be similar to the flu. Some people around the world in less developed countries are probably going to die. We may have a couple deaths here, but we're doing everything we can. We also have a world-class medical system here. We have a healthier population. We're going to be okay. We've got people on this. That's a hard message to deliver when just months earlier you had to draw a loop on a map to pretend like a hurricane was going to hit Alabama.
Chris, I disagree. That message is not hard to deliver. That message was delivered last night, Sunday night, as this podcast is being recorded. It was delivered by Michael Bloomberg. And unfortunately, it's coming during a presidential campaign, and he had to pay for the 3 minutes on CBS and NBC to deliver the message. And I'm not saying that he's my choice to be the Democratic nominee or president, but he was able to do exactly what needed to be done, deliver an address in a knowledgeable, informed, calm demeanor. And, that's somebody who had led New York City post 9/11, and so has some experience with crisis management and with all of the various, terrorism threats that happened in the decade after that. That is what we are looking for. I know the thrust of this podcast is coronavirus, and I'm not meaning to beat up on the president here. I try to stay even on him and respect his political know-how, but I will say I would not be surprised. Now, I'm not predicting this. I still think that his base is forever loyal, but I just wonder if this is a breaking point with his base, that they didn't mind all of the other stuff. They didn't mind any of the scandals, any of the foreign policy stuff, but in a time when they were scared. And I think, to be honest about it, I think the people who represent Trump's base are probably a little more susceptible to those people who are not part of Trump's base by this. They are people that maybe can't take off from work, that they are, kind of what people refer to as downclass white folks, and they might not have the same advantages. They can't just leave work and go stock up on things at CVS. And I wonder if they don't feel a little bit abandoned here, that the person that they did trust with everything else, that this is the one time that Daddy Trump could not take care of them. And I will be intrigued, and I will like to see how that plays out.
You hit on something there, and I was going to ask you about it anyway, so we'll get to it now. And that was, people going to their doctor or, taking some time off from work if they're sick. This is something I've seen Marco Rubio tweet out about, that, listen, it's not that hard. If you want to protect yourself from coronavirus, he lists 3 things. He says, wash your hands. Great advice. You should wash your hands anyway, but great advice here. And then the next 2 are call your doctor or the hospital before you go there. And the third one is employers shouldn't force people to come to work if they're sick. And I'm sitting there saying to myself, we are in a state of Florida where 20% of the working age population has no health insurance. So who are they calling when they feel sick? More to the point, 1 out of every 4 Floridians has a job that does not have paid sick time. And let me ask you this. If the choice is between paying the rent or going into work and possibly infecting some of my coworkers, which one do you think most people in Florida are going to do? I'd like to say they're going to stay home and protect their coworkers, but if you got to pay the rent, you got to pay the rent. And if you're not getting time off and cash to cover you while you're off, that's a tough place to be, and that's where we're at.
I know all the times I was waiting table, and I was feeling a little bit under the weather, and they always say to you, don't worry about coming in tonight. Well, then who's going to pay me the $150 that I was supposed to make that night on a busy Friday night? Where am I going to get that money? Because my owner of the restaurant was never going to pay me. And I think that that's what a lot of folks, like you say, especially here in Florida, every single one of those service employees, every single one of the exact people who we are asking to stay home, to self-quarantine, the people that are coming into contact with people at an airport and then coming into contact with more people. Those are the exact people who cannot afford to stay home. And so this privileged argument that we're making during the coronavirus, it's not only exposing our weakness on that, but it is, and as crazy as Bernie Sanders is, there's a lot of people who are out there saying right now, hey, this is the case for, Medicare for all. Because in a pandemic like this, it is not about the ceiling of your health care, about what the very elite can get. It is about the floor. And it is about what is the least among us. How is their health care? Because, I've got a guy right now working out in the lawn, or in the lawn. He's helping install some sod today. I know what my healthcare is like because I told you, I just went over to the doctors to get a little booster, and I know what his healthcare is like. His healthcare is now my healthcare because he and I've been working hand in hand today, and I've been, he's literally been passing me sod, so I'm as susceptible to whatever he has as I am whatever my doctor can give me.
And I would be remiss if I didn't point this out, that in 2012, Orange County, where I'm at right now, tried to put in mandatory sick leave for employees. The Orange County commissioners shot it down, and before the voters could get it back on the ballot, the Florida legislature usurped that power to Tallahassee. So municipalities in Florida now can't even regulate mandatory sick time. That is another one of those powers that Tallahassee has decided to keep for itself, which, again, 1 out of every 4 workers in Florida does not have paid sick time. If the choice is virus or pay rent, they're paying rent.
I mean, can we talk about the nuclear bomb that is Orlando? I mean, is Orlando the city that we have to keep number 1 on our watch list right now? Like, it would not surprise us if, LA with its gateway to the Pacific Rim somehow got exposed, and we would shut down LA. And it wouldn't surprise us if New York, and we would seal off Manhattan. It's what happens to Orlando, and maybe to a little bit of an extent to Miami, but it's Orlando. And, if 4 coronavirus patients pop up in, bad hotels in Kissimmee, our entire tourism industry goes to crap overnight. I mean, they will be canceling, every German travel agent will be canceling and sending people elsewhere right at the height of the tourism market, which is why I will say, and I'm going to post up this op-ed probably while we're, while this is being produced. If there's any time for us to back off of the argument to cut Visit Florida, as you know, Speaker Oliva has been one of the big critics of Visit Florida and spending for the promoting of the state. I don't care. I don't care if we're not getting whatever the ROI number, that it's not as high as Speaker Oliva would want. If there's any time where we need every, tool in the toolbox, it's right now. So let's get Visit Florida funded at whatever level they've been funded at as going forward.
People forget, though, that Visit Florida, and this is an aside, we'll get back to coronavirus and wrap up here in a second, but Visit Florida really came into its being after the Deepwater Horizon and as a method for getting tourists to come back to especially our Gulf Coast after that oil spill. And so it did serve a purpose there. I think you can have a hearty debate about how it's run and what it's doing. It's made mistakes in the past, but yeah, you are absolutely right. It's not going to take a lot. And Orlando is susceptible to this because we do have a lot of workers here that do not get the paid sick time, don't have great medical care or any medical care in some situations, and we do have a lot of international travel. And as we're finding out, it doesn't matter if you're coming on that flight from China or if you're coming on the flight from Italy, or maybe somebody who you just came in contact with who was there from Italy, and then you come up from Miami and you get to Orlando. It's not going to take a lot, and that's the scary thing. Again, whether or not coronavirus starts to dissipate tomorrow, and we memory hole it the way we have with swine flu or anything else, the larger issue remains: how prepared is Florida? How prepared is Orlando for the next pandemic? Because there will be a next one. Maybe it's not going to be so bad. Maybe it's going to be 10 times worse. There will be a next one. And we should be prepared, and we should be having those conversations before the pandemic strikes.
Well, I mean, and I don't remember. Are you a native Floridian? Have you been here all the time?
No, I got here in 2012. I came out of Texas.
Okay. Well, think about there was those incidents where, and I don't remember all the details right now because it was, I think, when I was a younger man, when the tourists were being killed, along the highway, and they had to put highway patrolmen in all of the rest stops, basically, and basically people were able to tell who was a rental car by the license plate, and I think there was 4 maybe murders of British tourists or something like that. I may be getting some of the details, but it's something like that. And that almost collapsed the Florida tourism market for that year. Lawton Chiles, I believe, was the governor and had to step in immediately. I think that's the same kind of situation that we're facing here.
All right, Peter, I'm going to let you go. I know you got a lot of work to do. Once again, good work by your team. Good work by everybody over there at Florida Politics on getting ahead of this story. And, the main thing I would say, just beyond the kudos and the pat on the back, is, what we all are striving to do day in, day out, and that is to hold government accountable and ask those questions. And you guys did a great job getting that information out there, and that's the most important thing. So thanks, Pete.
All right, I appreciate it. Thank you for, as somebody who listens to podcasts, I feel like I'm the one person that listens to all the political podcasts. I really like how this one has come along. You've had some good guests, and you're able to get them to talk a little bit more so than the average bear. So kudos to you and to this podcast. I think you've got a future in it, sir.
You're just saying that because you've been on now 3 times. So play your cards right, and there's a very nice steak knife set coming your way. And I want to thank Peter and Lauren for taking part in this. Again, this is something to keep an eye on. It just is. It is. It's something that we're going to continue to report on. And again, I think for the most part, and I said this interviewing Lauren, but I stand by it. I think our coverage here at WFTV, I think the coverage in the Orlando market that I've seen has been very much, here's the information, here are the facts, and you do what you need to do with that information, because there's no point in trying to scare people. And if something can be scary without it being something that is designed to scare you. And so, again, this is just the information. It's just what's going on. And again, this will not be the last pandemic we deal with as a country, as an area. There will be another one because there were ones previous to this, so there will be ones after this. It's just a matter of learning from this and being better prepared next time, and that's all you can ask. And I still feel like it's our job as journalists to ask those that we entrust to keep us safe what they're doing. And when they're not forthcoming, it's our job to ask them for that information and for them to just level with us. Let us know what's going on. So anyway, again, wash your hands. That is good advice now, and it'll be good advice 2 years from now and 10 years from now. Wash your hands. Hit them with some Purell every once in a while if you want, but little hot water, little soap, get in there, scrub them, about 20 seconds or so, do the alphabet, sing the happy birthday song, and you'll make your mom very, very proud of you that you washed your hands. Other than that, listen, have a safe week, have a healthy week, and I will be back in your feed before you know it.